A fourth death has been reported from a severe lung illness linked to vaping. The CDC says it's looking into more than 450 cases in 33 states. Health officials believe some chemicals found in e-cigarette and marijuana vaping products are to blame, but they've not identified any single device, product, or substance that's responsible. An article in the New England Journal of Medicine noted e-cigarette fluids contain at least 6 groups of potentially toxic compounds. CBS News chief medical correspondent Dr. Jon LaPook joins me now. Hi. Dr. LaPook, thank you so much for being with us. So since health officials cannot identify exactly what is causing this specific illness, what questions are they asking right now?
Well, one thing they've done is to kind of figure out, it doesn't look like it's an infection. That's a big deal. It looks like it's a chemical. And you have to think of what e-cigarettes are doing, and it's kind of like a chemistry set, right? So you have the fluid that's in there, and it's got all of these different chemicals in it. In addition, you're then heating it up. There's metal there, and it can combine with things coming off the metal. And the question is, what's being produced there? Maybe, especially, they warn that don't buy anything off the street, don't tamper with it,
right?
Because you're not knowing what you're throwing into that chemistry set.
Right. It sounds like a huge sort of mix of chemicals and potentially toxic chemicals reacting with each other. So now, are the CDC, are the scientists sitting down and trying to isolate each individual chemical?
And imagine how hard that is.
Yeah.
Because first of all, you're taking a history for people who may not be willing to totally fess up to what they're doing. I mean, in some places, marijuana use, cannabis use is illegal.
Right.
And the question is, how do you figure out all that concoction? Is there one chemical? Is it a combination of chemicals? They were looking at theories, maybe there was some kind of fatty lipid-like substance that's being sucked in, because some of the studies seem to indicate that there were these things called, lipoid pneumonia.
Right. Well, so many questions, still so many unanswered questions, but yet the CDC says the number of people affected by vaping-related illnesses has doubled. Right. So what is to account for that spike?
Well, so they wanted us to figure out a big question. That's a great question, because the question is it just that we're noticing it now?
Right.
It's been going on all along, but now we're kind of honing in on it. Or is it a true spike? It looks like, for now, preliminary evidence that it's a true spike, because they looked at this year and then a similar period a year before that in 2018 in Wisconsin and Illinois, where 53 cases were described, and it does look like there actually is a spike.
And so what would that indicate to you?
Well, you got to wonder, is something being added?
Right.
Is somebody's or some process happening that's putting substances in there that weren't there before?
Or are more people purchasing on the street, per se?
Perhaps they are. Perhaps it also is that we are becoming more aware, because with, when you look at lung disease, there are about 50,000 cases a year of pneumonia deaths, and there are millions of cases of pneumonia. So, and that could be confused with this type of an illness.
Right. So clearly officials are worried. So what can they do to combat this while they continue to investigate what the actual cause of the specific illness is?
I think it's fairly extraordinary. I mean, can you put a modifier like saying fairly unique? I think it's extraordinary that the CDC has said to consider. It's a warning. They're going to say consider not vaping pending this investigation. I just spoke to them. They're not willing to say
stop vaping. Right.
They're saying consider. I said, what is that supposed to be? It's like if you're sounding the alarm, it's like, and it's an alarm for a fire. Are there people who still stay in the building? No, most people are going to run out, but they're not willing to say stop it. They're saying consider stopping it, and look for symptoms. So any kind of lung disease, any kind of respiratory symptoms. There are other symptoms too, like gastrointestinal, nausea and vomiting, and diarrhea,
one thing is
fever.
for sure, with each passing month, we seem to get more and more alarming medical news about vaping.
Yeah, and I think now it's under the microscope. I think it's got everybody's attention. And one thing people out there should, be aware of is that if they have been vaping, particularly if it's on a regular basis, like daily or almost daily, and they have any kind of respiratory symptoms, you got to check in with your medical provider. And
what about teenagers? Are they in greater danger from this illness?
Teenagers tend to vape at a much higher dose rate than adults. I think I saw it was like 20% versus 3% or something like that. I could be off, but it's a much higher rate, and it's been increasing exponentially. The companies who make these devices have been fighting claims, charges from other people. Look, you've been targeting the young people, and now maybe they're backing off a little bit, but they're already in the schools. They use these devices. They're like USB device ports, and so they're easy to hide. And I interviewed a young man the other day. He was 17 years old, and he said the bathroom is now called the vaping or jewel room. And the joke is, how come there's a toilet in the vaping room?
That's terrifying news to any parent, especially when we hear that along with this new information from the
Well,
CDC.
this is very serious news, and I think people really need to pay attention to it and then just keep tuned, because we're going to keep giving you more and more information on this.
All right, Dr. Jon LaPook, thank you so much.
Great talking with you.